Hi, this is Dave Walsh, the owner of Revive Personal and Sports Training Fitness Studio, located at 251 Morris Ave, Suite 1B in Springfield, New Jersey. Today we are coming to you with week 13 of our weekly home exercise video demonstration. Today we are going to be doing shoulder rehabilitation training. Last week we did knee rehabilitation training. So keeping in mind that shoulder rehabilitation training, we are trying to do exercises to stop injuries from occurring, and if an injury occurs, help you rehabilitate your shoulder muscles so that you can get back to your activities of daily living as quickly as possible. Okay, so please keep in mind, just like with the knee stabilization from last week, if you do have a shoulder surgery or if you have a shoulder injury that requires you to see an orthopedist and a physical therapist, I will get a medical clearance form from your orthopedist, and I also will get the exercise prescription from your physical therapist, and I will collaborate with them very closely on a regular basis moving forward so that we can make sure that the program is progressing the right way, and we are all working together in unison as a team. So keeping in mind with the shoulder, there are different shoulder injuries, okay? Frozen shoulder, which is a very common shoulder issue. Another one is bursitis. Another one is arthritis, okay? Rotator cuff issues. These are all shoulder issues that people have on a regular basis. And what we're going to try to do is give you some exercises, again, to help alleviate the injury or injuries from occurring, and also to help from a rehab setting, okay? So we're going to try to do exercises to also stabilize the shoulder and also to work on your posture. The better posture you have, that'll help with the shoulder muscles as well. Okay, so frozen shoulder actually is adhesive capsulitis. Just to backtrack a little bit, that's the technical term for that. And that's when you have pain and stiffness in that shoulder joint. Okay, so what we're going to do first is we're going to do the anterior deltoid muscle. One of the exercises for that. Anterior deltoid is in the front anterior part of the shoulder. Okay, we're going to grab our dumbbells. Very simple frontal raises. Okay, right foot forward, back straight. We're going to do 20 reps of these. Okay, you could do 20 both together. 20 right left. If you do a sequence right left both like we've done in the past, that's 12 to 15 reps. Okay, so right foot forward, back straight, cervical spine looking straight, protect that neck we talked about in the past. Frontal raises. Okay, 2-degree bend in the knee. 2-degree bend in the elbow during the extension. In the knee as well, we did that last week obviously. Okay, breathe out when you go up. Don't let the weight go above your shoulder level. Okay, that's your anterior deltoid frontal raise. Next one is a lateral raise. Lateral is going to work the medial deltoid, okay? The side of the side deltoid muscle. There's 3 deltoid muscles: anterior, medial, posterior. We just did anterior, now we're going to do medial. Medial is a lateral raise. Very simple. Slight bend in the knees, back straight. Breathe out, come straight up. Again, don't have the weights higher than your shoulder level. Right there, okay? Another way you can do that, if you do have shoulder issues, any shoulder issues, you can do what we call scaption. Scaption means instead of going out to the side, you're going to come in on a 45-degree angle. Okay, scaption, 45-degree angle. Don't have the weights above your shoulder level. Okay, so now with the posterior deltoid, okay, this is going to be a bent over rear deltoid exercise. Now in the past, week 10, we did the combination training with the triceps. This is the same premise. It's going to be a bent over position. Back's going to be flat. Try to think of a piece of glass on your back. You want to have your back nice and straight so that glass does not fall off onto the floor. Keep your core nice and tight. Back straight, slight bend in the knees. Come straight up. Okay, slight bend, come straight up. Breathe out when you go up. Okay, again, you can go right, left, both for 12 to 15, right, left for 20, or both together for 20. Okay, next one we're going to do is we are going to grab our water bottles. Okay, this is going to be shoulder flexion. We did this back in week 8, senior fitness part 2. Okay, if you want to check the videos, you can go back and look at that. So shoulder flexion, back straight, arms come straight up over your head. Okay, very simple. Breathe out when you go up. arms over your head, okay? Very good, like we talked about in the past, washing windows from a functional standpoint, getting a light bulb turning, you have to lift, get your arms up high for that, okay? Very good for senior citizens. Okay, the next one, again, senior fitness part 2, shoulder shrugs, okay? So again, we're gonna come straight up, hold for 2 seconds, straight down. Straight up, hold for 2 seconds, straight down, okay? These two exercises work the rhomboids muscles, the trapezius muscles, and the muscles up into the neck area, okay? Rhomboids, trapezius, posterior deltoids, okay? You get all those out of that. So again, 20 reps on each of those, okay? So now what we're gonna do is we're gonna go into the external rotators, okay? So the external rotators, the muscles are the muscles of the rotator cuff, okay? We have the supraspinatus, infraspinatus, teres minor, and subscapularis. Those 4 muscles make the rotator cuff. Now, a lot of rotator cuff issues and or injuries like we talked about in the beginning. So external rotators, internal rotators are the best exercises to help alleviate that, okay? In addition to, well, I'm gonna get to those and I'll circle back to the prone exercises, okay? So from a standpoint of an external rotator, we can use our shoulder horn like we have at Revive, okay? So what we do is we put this on here, oops, okay? We'll grab our dumbbells. Again, you can use water bottles at your house. You can use, we have dumbbells at the gym, obviously you could use light ones. And this is a shoulder horn that we have at Revive. Very good for tennis players who have rotator cuff issues, baseball pitchers who have rotator cuff issues, quarterbacks who throw the football, any throwing movement, javelin and so forth, does put a lot of strain on those rotator cuff muscles. This exercise is very good for that. So what you would do is you would stand right here, externally rotate, okay, those dumbbells. So if you see how the stabilization is set up, you can't cheat at all with this. Okay, very, very effective modality. Okay, again, 20 reps of these works those external rotators. Okay, so another way to do external rotators is we can lie on your side like we did last week with the week 12 knee stabilization exercises. Okay, this is going to be same premise we did last week. Okay, if you can go up on your elbow, that's fine. If you have a neck or a shoulder issue or an elbow issue, you can lie sideways. Okay, so external rotator, elbows tight. It's best to use a towel to give you a little bit more stability and support with that shoulder. Elbows tight. Okay, nice and easy. You're gonna come straight up, externally rotate. Okay, very specific right there, getting those muscles. Again, 20 reps, go right back up. Okay, again, last week we did the external rotator with the band above the knees for the hip stabilization. Okay, which we talked about last week with the knees working the muscles around the knee joint. So the same premise is the same for the knees and the shoulders. Okay, so now another external rotator, we can use our bands, okay? We have different bands at Revive, red, green, and black. Red is the easiest, green is middle, black is the hardest. So for today, I'm gonna use the red one. So again, external rotator, okay? You can have your elbows tight, 90-degree bend, and you're just gonna have your forearms come straight out. Different way to do the external rotators, okay? So again, elbows tight, forearms come straight out. Look from the side, shoulders back. Okay, works those muscles again. You can also do this single arm, single foot. Work a little core stability. Okay, hold with the left, externally rotate with the right. Okay, so it's always neutral grip with the hand doing the work. Breathe out when you go out, 20 reps. Again, so going on the single foot works a little bit of core. Knee stabilization works a little balance, coordination, a little bit of an advancement from having both feet on the ground. Okay, again, closed chain movement, 2 feet down. Unilateral, 1 foot up, we talked about in the past. Okay, so there's the external rotators using the bands. Okay, you can also do a deltoid exercise with the bands. Okay, arms are going to be straight. So now we're going back to the rear deltoid muscles. Okay, straight out to the side. So again, straight arm, both out. Okay, breathe out when you go out. Breathe out when the arms go out. Okay, so external rotate, rear delts. Okay, rear delts are working the rear deltoid muscles, the posterior. Okay, so now also at Revive we have, if you can visualize, a bench. Okay, you put the bench on an incline. You go on the bench, prone position, head chins over the bench. We have you do prone rows. Okay, prone rows are very good. We would use a little heavier weight. Okay, we're going to pinch and pull in a prone position. So if you're prone, you pinch and then you pull. Pinch, pull, okay? Breathe out when you go up. When you pinch, you're mimicking the shoulder shrugs we did back here. When you're pulling, you're getting those trapezius and rhomboid muscles up in the shoulder, okay? You can also do prone T's. Prone T, head down, straight out to the side, straight back, making a T. Out, back, okay? So there's your medial deltoid, posterior deltoid, okay? And the last one from a prone position is your supraspinatus raises. We put the thumbs up. Again, visualize being prone on a bench. Come straight up. Supraspinatus raises, okay? Very effective, gets all those muscles up in the shoulder area. Okay, now from a rehabilitation standpoint, we can use what we call the pendulum, okay? Pendulum is you would take a dumbbell, okay? You can use your couch at your house, put the right foot forward, grab the couch with your hand for balance, put the dumbbell in between your fingers, let the dumbbell hold, and just go around like a pendulum. 25 each direction. It's a great stretch. Works out all the muscles up in the neck and the shoulder area, okay? Very good, like the shoulder shrugs, to decrease stress. We're all under a lot of stress with the pandemic, a lot of stress up in the shoulders and the neck. This exercise, as well as the shrugs we talked about, very good to decrease the stress up in that area. And then the last one is the upper body ergometer. Okay, upper body ergometer, we have it Revive, is a standing arm bike. So if you think about a seated bike for the legs, standing arm bike. So you would just stand, go around in a circle, okay? Loosens up all the neck muscles and the shoulder muscles. We usually have you do 3 minutes forward, 3 minutes backwards is a good warm-up, okay? Interesting about that from a stress standpoint is it's the water inside the UBE is the resistance, and a lot of people say that it has a sound of tranquility and serenity when they go around. So it actually gives a nice calming effect when you're warming up those shoulder muscles, okay? And also the last one in terms of the stress and blood flow and everything, try to decrease injuries. We talked about, I showed you this last week, I didn't show it to you, okay? This is just a very simple massager, okay? Take this, nice and easy, just massage your quadriceps, okay? 30 reps forward, 30 reps back, increases the blood flow in the area, helps to decrease stiffness and pain. You can do this on any parts of your body, okay? Shoulder, you can use your calf for your calf muscles, gastrocnemius soleus, all different parts of your body, okay? Very good modality at Revive that we have. Lastly, I just want to say, back in week 10, combination training, I made a mistake. Success, it's 90% attitude, 10% skill. Last week, week 12, push, the acronym PUSH, it's persistence until something happens. Very important, persistence until something happens. Okay, and then with this pandemic, a few quick things. Number one, try to stay social, okay? Try to do FaceTiming with your family, your friends, call your family or friends, email, text, whatever you can do to stay social, that'll help. Number two is sleep. Try to get good sleep, 6 to 8 hours a night. Try to have a sleeping time where you wake up and go to bed relatively consistent all 7 days. That'll help your sleeping patterns, okay? Number three is exercise. Walk around your neighborhood. Try to do social distance walking in your neighborhood. Walk up and down your stairs if you have them. Walk around your house. We did stairs back in week number 1. And then the last one is just try to be good to yourself and try to laugh once a day. Thanks and have a great night. Bye.